can ask her also, or you can write your question in chat box. Okay. So Priya ma'am.
Yes, ma'am.
Hello.
Yes, yes.
So shall you start now?
Okay. So how many have joined? Abhishek, Dr. Arpita Chatterjee, Darsh.
Everybody has
Everyone
joined.
has joined. Great, great. Okay, sir, shall we start with the invocation prayer?
Sure. Om Shahana Bhavatu Shahano Bhunaktu Shahubijam Kadubhavahai Tejashina Badhi Tamastu Ma Vidvishabhai Om Shanti Shanti Shanti. Supriya, I am making you host.
Yes, sir.
Yes.
Okay. Good evening, everyone. How are you all doing? Am I audible? Am I audible and visible to all?
Yes, you are audible.
Okay, so this
Yes,
is going
yes,
to
you are audible and visible.
Thank
Student,
you.
please communicate Priya Verma ma'am, please.
Okay.
Yes, welcome, ma'am.
Thank you. Okay, so this is going to be very interactive class, and I'm going to ask you a lot of questions, because unless you reflect on the questions, you think about how and why we are talking about it, none of it is going to make any sense, because I am not just reading the slides. It is skills you are learning, and the skills should be able to be, you should be able to apply those skills. Good evening, everyone. Okay, so the first question, why we are talking about directive and non-directive techniques to begin with. Before we proceed to our today's topic, let us all talk about what do you understand by counseling. One by one, please unmute yourself and talk about what do you understand. No bookish language. No one is going to Google it and read the definition. In simple terms, what did you sign up for when you enrolled for this course, and what do you understand by counseling in very simple, easy terms? Who is going to go first?
Yes, ma'am, me, Darsh.
Darsh.
So,
Okay.
ma'am, counseling is, if we say something about counseling, so counseling is a simple technique. It is a talk therapy. It's an opportunity to talk and to a professionally trained counselors who are there with us to advise us, to support us, to guide us, and give a new perspective for our issues or our problems.
Okay. Who was speaking?
Madam, may I?
Okay. Please tell your name before you're speaking.
Yeah, myself Urpita
Yes.
Chatterjee.
Yes, Dr. Arpita. Please go ahead.
Yeah, as a layman in this subject area, I am not a psychologist or psychiatrist. So to me, counseling is a process by which we can try to reveal the inner feeling of a person by the way of verbal or non-verbal communications between a client with a therapist or counselor. So it is the mode to reveal the inner feeling of the client.
Okay, to reveal the inner feeling of the client. Abhishek raised his hand. Please go ahead, Abhishek.
Yes, ma'am. Namaste, ma'am.
Namaste.
Ma'am, counseling is a simple thing to support a person and means internally if he is disturbed and he feeling any problem, then we find out and his self build up. That's the simple thing. Yeah,
Okay.
we try
Great.
to support to self build up. Yeah.
Amazing. Okay. Who is going to attempt next?
Ma'am, sorry for the interruption. I just want to add one point for
Yes.
me
Add,
previously.
please add.
That is not only to reveal the inner feeling, but to solve in a positive direction to help the client also, ma'am.
Okay. Very well done. Who is going to try next?
Ma'am, may I?
Yes, please.
Counseling is a process by which through which we can help a person to choose a positive and effective way to deal with environment.
Okay. Interesting. Okay. Who else is going to add to what she said? Do you agree or disagree with anything? Ki ye nahi hai, this is not the right thing. I want to add something more to it.
Ma'am, it is a way to solve some issues in client's life, or the issues they are facing in their life, to show some light in a positive way to resolve their issues and give them some support, psychological support.
Very well done. So all of us do agree that counseling is helpful in so many ways, that it is a process. A person goes through some change. If you want me to also add in Hindi, please interrupt me and ask me. Matlab samajh mein nahi aaya. If you want me to translate anything, any technical word in Hindi, or if you want any example of the same thing, please go ahead, interrupt me and ask me the example. Okay. So all of you had very well described what counseling is. So one thing which was very common in all of your definition, that counseling is a relationship, right? Ek akela, one person alone cannot do his or her counseling. It is a relationship between a counselor or a counselee, right? It is a relationship for sure.
Yes, ma'am.
Then
Yes.
another thing, someone is going through any process, it is going through any process, the relationship is going through any process, and the process involves unlearning, relearning. Okay.
Yes.
You are unlearning a few patterns, you're identifying few patterns which you might need to unlearn, you're relearning a few things, right? So there are various definitions given by so many psychologists and the people who are studying counseling as a subject. So I'm going to tell you a few definitions. I will share the document with you. So in whenever if you want to quote some definitions, there are so many definitions, and over time these definitions have evolved. Earlier it used to be the counselor does something to the counselee, but over time the definitions have evolved. So basically counseling is an application of mental health. Mental health is the main area of counseling, and through which we are trying to achieve something. Maybe it is personal growth, it is better mental health, clarification about career, some psychological concerns, and the counselor and the counselee work together to achieve some common goals, right? It is not the counselor taking the counselee's hand and taking him to some place. Yahan pe jao, this is the goal I want to achieve for you. Both of them mutually come together for some common goals, and together they want to find out something, and at the end of it, every counseling session should have an outcome. Without outcome, there is no direction. Okay, so we are looking for some kind of direction, some kind of approach in how we are proceeding. So the image I have showed you, I'm beginning to see some change in you. So here we
ম্যাম
are.
শোনা যাচ্ছে না,
Sorry,
শোনা যাচ্ছে না ম্যাম।
I did not get you. Are you able to see the screen?
Yes, the screen is visible.
Yes.
Screen is visible.
Okay, it
And
is
you are also audible. I think it is her network issue. Your voice is screen also is visible.
Is my voice breaking?
No. You are audible and your voice is absolutely clear.
Okay, great. So the picture which you are seeing is that I'm beginning to see some change in you. Here, this person is a counselor and this is a counselee. So this is a kind of relationship that over time this person was attempting to see some changes, and the counselor here is saying that I'm beginning to see some change in you. Okay. So it is a relationship between a counselor and a counselee. Okay, so together we will go forward. I will share the definitions with you. All of you have shared all the points which consist of which define counseling as a therapy, psychotherapy, counseling. What does it look like? So there are different definitions given by different psychologists and different people. If you want to quote, please quote with the name and the year so that it can be identified which counseling definition comes closest to you. So yes, counseling is a scientific process of assistance extended by an expert in an individual situation to a needy person. The person has to be needy, and needy does not means financially needy. The needy means the person should have any goal, the person should have any desire to go for a counselor. Many at times you especially in terms of friends, you know that this person might require a help of a therapist or a counselor, but unless that person is convinced himself or herself, you can only tell them, please go visit a counselor, please you should try therapy in case it might help you. So the person should feel the need himself or herself. So counseling involves relationship between two persons. So it is not just two persons. Sometimes the counseling is one-to-one, and sometimes it is also done in group settings. One of them is counselor, which attempts to assist the other so in organizing himself as to attain a particular form of happiness, adjusting to life situation, or in short, self-actualization. So through counseling, we are trying to do so many things. Sometimes we are trying to have a clarification for career. We go for career counseling. Sometimes we are trying to resolve a conflict in a family situation, or within couples, we are trying to resolve a conflict. We are trying to learn the interpersonal communication. In career counseling, we are trying to identify the career goals or career streams or new streams. When we go for geriatric counseling, the dynamics are absolutely different. Geriatric counseling refers to counseling given to old age people. So I have given 3 examples. Each one of you, please tell me one more examples you have heard of, any specialization of counseling, any area of counseling other than these 3.
There are also health psychologists.
Yes, health psychologist.
The school counselors.
School counselor.
Rehabilitation psychologist.
Rehabilitation psychologist, yes.
Sports psychologist.
Sports psychologist, very well, yes. Abhishek?
I'm also corona counselor.
Corona counselor, okay, that was action based counseling, which required a specific area of counseling. So yes, you were also counseling for a specific area or a specific task where you were assigned a task to help people who were maybe facing anxiety due to COVID situation, and they were not able to understand. And as we all know that COVID as a pandemic was anxiety provoking to all of us. So yeah, but that was okay. Who else is going to give me another example? We have covered health psychology, rehabilitation. Yes. Yes, Sudipta.
मैम एक हमारे उसमें भी होता ना, अपराधियों के लिए होता ना पर्सनल काउंसलर.
Yes, yes, personal counselor. Yes, yes.
उसमें कभी कभी हम जेल में जाके भी काउंसलिंग करनी होती है हमको.
जेल में जाके भी होती है, बिल्कुल बिल्कुल.
और नशा मुक्ति में भी मैडम करते हैं.
हाँ, de-addiction counseling is also there. De-addiction नशा मुक्ति में when we are trying.
काउंसलिंग होती है. फैमिली काउंसलिंग भी करनी पड़ती है.
Family counseling and couple counseling is there. So all of them, all of these are some areas of counseling which are aimed at a specific area, specific demands, specific set of clients, and different skills which are required. But the aim is, it is a relationship where two persons or a group of person attempt to assist each other, and they have to attain, they have a goal, and it might be happiness or adjusting to life situation or self-actualization. We are trying to find ourselves, we are trying to find a sense of self. So this is how overall counseling as a setting looks like. Okay, so today we are talking about types of counseling approaches. The first one is, yes.
Madam, counseling is nowadays also needed for student. In fact, in infant stage also, to develop some interest in education. And
absolutely. Educational psychology is gaining so much impetus in India and everyone everywhere else, because at early age, children are made to explore different choices, and at early age we want to find out the developmental stages are they in, and how to explore their own choices, their relationship with their parents, with education, what are their own unique challenges which can be tapped early in the ages, so that when they grow up they do not find any difficulty in adapting to a curriculum. So yes, educational counseling is also gaining. Thank you. Okay, shall we move ahead to directive and non-directive? Okay, before we move ahead, what do you understand by directive and non-directive in easy language? What do you understand by directive and non-directive approach?
Hello.
Yes, yes, I can hear you. Go ahead.
I don't know actual the subject area, but I think directive in directive approach means a counselor should direct the client in a specific way, in a specific manner to reveal the means to run the counseling process, and in directive way there should not be a particular protocol to have. Here we can improvise in his or her own. Maybe like this. Is it true, ma'am?
You're getting there. Okay. Who else wants to add to what Dr.
Directive approach may be like giving a direct answer or a solution to a problem, and non-directive is for guiding them, summarizing, paraphrasing. It includes certain processes and certain stages, and then after that, the problem is solved.
Okay. One question to you after everyone is done. Darsh, okay. Who else want to try to define directive and non-directive approaches? सबको बोलना है. Everyone has to attempt.
एक्चुअली हम भूल गए. हम बाकी अभिषेक बोल रहा हूँ. डायरेक्टली मतलब मीन्स जिसमें हम केवल उसको सपोर्ट करना था, जो भी हमारा क्लाइंट थे, वो कोई डिसीजन लेने में जो होता है उसको प्रॉब्लम होती है, तो उस डिसीजन में उसको गाइड करना होता है। और इनडायरेक्ट में जो किसी से ग्रस्त है तो उसको एक एक स्टेप बाय स्टेप फॉलो करना पड़ता है मैम। उसको एनवायरमेंट लेके स्लोली उसको तैयार करना होता है,
अच्छा,
मेंटली फिजिकली, इस तरह से।
ठीक है। वेरी वेल। हु इज नेक्स्ट?
Directive means we can if you give a way, specific way to go through the process, or and if we not give the specific way and सिर्फ हेल्प करना है, जो क्लाइंट जो चूज करे, 1 2 3 ऐसे ऐसे करके 2 3 वे हम दिखा सकते हैं, जो उससे वो चूज करे, उसमें उस वे में वो अपना प्रॉब्लम सॉल्व कर सकते हैं कि नहीं।
ठीक है। ओके, एवरीवन इज डन? और किसी को बोलना है? किसी को ऐड करना है? आगे बढ़े, शैल वी मूव अहेड? ठीक है। ओके, so directive counseling, it is also known as prescriptive counseling. What do you understand by prescriptive? Okay, prescription सबने सुना है, everyone has heard of prescription. Prescription is something the doctor gives you for medication, a list of medication, when to take, how much to take, what is the dosage, when to start, when to finish. Okay, so it is also known as prescriptive counseling. So who gave the idea of the directive counseling? E.G. Williamson is the chief exponent of this viewpoint. So it is a counselor-centered approach. Directive counseling is about the counselor direct the client to take steps in order to resolve his conflicts. So here the role of the counselor is to direct the clients. The counselor will tell you the steps in order to resolve the conflicts. So why are we assuming that the counselor has to tell the steps to the client? Because it is based on the assumption that client is not able to solve his problems, or the client has lack of information due to which the client is not able to understand certain things. That means we have to direct them. हाथ पकड़ के लेके जाना पड़ेगा कि यहाँ से यहाँ तक चलो, because the client is so confused or does not have enough information, and the client is so puzzled that he or she is not able to solve their problem. So the client needs a helping hand. That is why directive counseling approaches are being followed. So here the role of counselor becomes important, because it is counselor-centered approach that the counselor have to play all the roles. So he also wants to direct the thinking of the counselee or the client. So by informing, by explaining, by interpreting, by advising. So all the work, all the roles are shouldered by the counselor. Counselor has to shape the ideas of the client, that what is the way of his or her thinking, where he or she is faltering, and by informing, adding some details, explaining, clarifying, interpreting of the entire events, and then advising. So here a much of intellectual aspect is the importance of intellectual aspect is given, because we are breaking down the complex information into simple parts. So here we are directing, we are breaking down the complex information given by the client, and then we are trying to break it. So it involves a lot of intellectual practice and intellectual appeal to it, rather than emotional aspect. Emotional aspect is also there, but more importance given to intellectual aspect. As you can see, the thinking, the thought process, and how it is impacting the behavior, the problems in thinking, the problems in information processing, the problems in interpreting the events. So this is how directive counseling goes ahead. There are certain steps in directive counseling. So Williamson, जिसने directive counseling के बारे में बताया, he gave 6 steps for directive counseling. So the first step is synthesis. What do you understand by synthesis? Sorry, it starts from analysis. The first step is analysis. The first step is analysis of the problem, analysis of the issue which is presented by the client. So after the client provides the information, the counselor analyzes it, where the problem is lying, what are the core issues, what are the contributing factors, how the client is interpreting it, what are the challenges which are in the thought process which are being faced by the clients, what are some faltered ways of thinking, what are some behaviors which require relearning, what are some cognitions which are unhelpful cognitions which can be attempted, which are not helpful. After analyzing it, the synthesis is done. What do you understand by synthesis? Synthesis clearly means breaking down the complex information into small parts to understand it easily. And after that, some diagnosis is given. So it does not have to be a clinical diagnosis. The diagnosis can be clinical and non-clinical. So it can be broadly giving a clinical diagnosis such as bipolar disorder, depressive disorder, mania, anxiety disorder, general anxiety, GAD, or many other things. By non-clinical diagnosis includes the person is going through a difficult phase which might have a combination of a few things. So diagnosis would not be clear cut in the beginning, but you can identify that some symptoms are very high. So if you are a psychology student, and even if you're not a psychology student, in order to diagnose something, you need to meet a certain diagnostic criteria given by DSM. Okay. So unless the diagnostic criteria is met, you cannot diagnose as a clinical psychologist. So even if you are not able to make a proper diagnosis, you can see that the person is on the lines of depression or can go into depression if the situation persists, or the person keeps behaving like this, or the present situation is not intervened. So even if you cannot give a clear-cut diagnosis, you can see that the person is more than anxious these days, and it might get into severity towards a diagnosis. So at least some direction can be identified where that person is lying. Okay. After that, appropriate counseling is given. Okay, so there are certain approaches of directive counseling, such as CBT, REBT, which has a clear-cut formula for every step. How to identify the ABC behavior, the ABCDE approach of behavior therapy. So a proper counseling is given through a channel, or following an approach, following an intervention. Okay, so the counseling sessions are designed in such a way. After that, follow-ups are done to understand the progress, to understand how many outcomes or the goals have been achieved. So the entire process of directive counseling goes through all these 5 steps. These steps can take a longer time because yes, every step has the counselor has a very important role while doing and while navigating through these steps. But since there is a direction which is there and the counselor is telling the client step by step, ye karna hai, now this, now that, now you have to keep a thought diary. Now after keeping a thought diary, you will be able to identify your harmful and unharmful or intrusive thoughts. Then you have to learn to tackle some thoughts. You would be aided with some skills to tackle with those thoughts by rationalization, by intellectualization, by so many methods which could be shared by the counselor, and some role play, some activities which could be done in a session. So by this, you are following a protocol, as Sudeepta or Arpita, I don't know who shared, but there is a protocol which is being followed. So if you know REBT, CBT, they have a set protocol that A means that, B means that, C means that, and there are certain techniques which can be utilized for a REBT or a CBT session. So there are step-by-step protocol, step-by-step things which are to be done in a directive counseling. Do you have any questions?
No, ma'am.
Okay, great.
हेलो मैम,
Yes.
अभिषेक है।
हाँ जी अभिषेक।
डायग्नोसिस ही मेन प्रॉब्लम होता है मैडम बहुत सी बार।
हाँ, डायग्नोसिस इज
एनालिसिस हो जाए ठीक है, जो भी आप डेटा से कर लेते, लेकिन डायग्नोस्ट ही मेन प्रॉब्लम। डायग्नोस्ट अगर अच्छा हो जाए तो फिर हम मतलब हमको पता लगता है हम किस तरफ से जाना चाहिए, क्या हम करना चाहिए, स्टेप फॉलो करने चाहिए हमें।
One thing I want to ask you, Abhishek, क्या हमेशा डायग्नोसिस करना संभव होता है?
नो मैडम, एक्चुअली इसमें प्रॉब्लम क्या आता है, जो मैं प्रैक्टिकली महसूस करता हूँ कि जब तक हमारा क्लाइंट से रिलेशनशिप स्ट्रांग नहीं होता तब तक वो फीलिंग्स पूरी शेयर नहीं करता है। मीन्स हाफ कभी क्या बताएगा, थोड़ा कभी क्या बताएगा, या फिर वो कभी 50% चीज बताता है, पूरी बात नहीं बताता है। और फिर धीरे धीरे हम जैसे एक रिलेशनशिप मेंटेन होता है, उसको बिलीफ सिस्टम बढ़ता है, उसके बाद फिर वो रियल में अगर विश्वास हो जाता है तब वो हमको बताता है रियलिटी, तब तक वो घुमाता है हमें बहुत सी बात।
बिकॉज जब तक उसको क्लाइंट को एज ए काउंसलर आपके ऊपर विश्वास नहीं होगा, वो खुल के अपनी गलतियां कैसे बताएगा? ये तो बिल्कुल ऐसा है ना कि मैंने मर्डर कर दिया और मैं तो बता दूं कि उसने मुझे मारा था इसलिए मुझसे चाकू चल गया, बट मैं ये थोड़ी ना बोलूंगी कि है ना मेरी भी इच्छा कर रही थी उसको मारने को। ये तो मैं अपने क्लोजेस्ट पर्सन को ही चुपके से बताऊंगी कि आई वाज एक्चुअली एंग्री ऑन दैट पर्सन।
इसीलिए इसमें डायग्नोस्ट करना सबसे पहले।
So the diagnosis part comes, it does not come very easily, and sometimes you cannot diagnose, you cannot label a person. So right, sometimes the person is not following all the criteria of an anxiety disorder, but the person is feeling anxiety. हम continuum देख रहे हैं ना, हम एक scale देख रहे हैं। Suppose this is a scale, this means anxiety disorder, बट एंजाइटी तो यहाँ पर भी है, एंजाइटी तो यहाँ पर भी है। इसका मतलब ये थोड़ी ना है कि वी वोंट ट्रीट दैट पर्सन। द डिग्री ऑफ एंजाइटी और द डिग्री ऑफ सिम्टम्स में वेरी. It may vary from session to session. It may vary from person to person. It may vary from situation to situation. But do we need a diagnosis to do counseling for a client? Sometimes a person is only feeling anxiety in a specific situation, but it is not to the extent that the person is following the criteria of a disorder. So sometimes we have to stop ourselves from binding a person into a diagnostic criteria. Sometimes we have to attempt counseling, and we have to attempt counseling on the basis of the symptoms being presented by the client, the difficulty being presented by the client. आप किसी अगर मेडिकल उसमें कंटेक्स्ट में समझें, will you only admit a patient unless he has a pneumonia? बट वो खांसी जुकाम के लिए आएगा तब भी तो आप दवाई देंगे ना। because that is also bothering the person. Pneumonia does requires instant hospitalization and treatment, but the person who is going through flu also requires attention and intervention, because his entire day is being impacted by the constant sneezing, the constant headache. Similarly, a person who might be having a low degree of anxiety, the person is not able to relax, even if the anxiety is not enough to shake that person, but the anxiety is enough to disturb that person, that the person is only thinking about anxiety, the person is not able to relax, the breathing is higher than usual, the person is eating really fast, the person is drinking really fast, the person is not able to write, the writing gets illegible, the person is not able to focus and concentrate. This is what happens during examination. Do we have anxiety? All of us do face some amount of anxiety during examination, but does that mean all of us have anxiety disorder?
No, ma'am.
Are you getting
No,
what I'm saying?
no, ma'am.
Sometimes diagnosis is not exactly required. So I am going to give you another example of
Yes, ma'am. Yes, actually, may I?
Yes, please go ahead.
मैम एक्चुअली डायग्नोसिस एक पॉइंट में जरूरी होता है कि ट्रीटमेंट जहां तक होगा हम लोगों का गोल ये रहना चाहिए कि उन पर्सन का हीलिंग हो जाए.
Right. Diagnosis is important, because without diagnosis we cannot plan the
ट्रीटमेंट प्लान करने के लिए वो जरूरी होता है डायग्नोसिस, लेकिन हम लोगों का एकदम पक्का गोल होना चाहिए कि हम लोग उन पर्सन का हीलिंग, जो सिम्टम सफरिंग जो है, सफरिंग को कैसे
reduce कर सकते हैं.
Yes ma'am.
So our aim is not diagnosis, even if we are talking about rehabilitation psychologist. Yes, Shresi. Okay. So even if when we are talking about clinical psychologists, rehabilitation psychologists, their aim is not diagnosis. Their aim is the healing of the person, the well-being of the person. Okay. The diagnosis only helps in the direction of treatment. So if the person is able to feel better even after the first session, that yes, I had so much tapped inside me, and after the first session I would at least able to let out, I was able to vent out, so even that is one step towards healing. Even if in the first 3 sessions we did not come to a diagnosis, we are just able to see that the person is looking stressed, we still do not know kahan se aa raha hai, we still are not able to find out ki itna strength nahi hai, but the person is visibly distressed. This happens. This will happen when you practice. Even after 4 to 5 sessions, you would be able to find out kya ho raha hai, what is happening, the entire story, but you won't be able to find out a diagnosis. Does this happens if you have started practicing, or from your personal experience, does that happen that even after 4 to 5 sessions, you're not able to come up to a diagnosis? Are you getting what I'm saying?
Yes ma'am.
Yes, ma'am.
So if you're not able to come to a diagnosis, please don't lose your heart. Our aim is not to find a diagnosis. Our aim is to make that person feel good even after first session, even if not feel good, feeling comparatively relaxed. And even after 4 to 5 sessions, you're not able to come up to a diagnosis. That does not mean your counseling is ineffective or you are incompetent as a counselor. No. Not everyone follows the set criteria for a diagnostic diagnosis. Okay, so this is one challenge which may come up when you are practicing. Not everyone has anxiety disorder. Not everyone has depression, but they can be visibly disturbed by what is happening in their life. Okay, let's move ahead. Okay, so when we spoke about, okay, before we talk about merits and demerits, I want to tell you, have you heard of CBT, REBT?
Yes, ma'am.
Cognitive behavioral therapy, rational emotive behavioral therapy. So these therapies, if you have already heard about it, or you would be reading or studying these therapeutic techniques in the upcoming lectures, one thing you have to keep in mind that they have a structure which is followed. That how the thought process can be broken down into several units, and what could be the antecedent, A, B, C, antecedent factors, the behavior and the consequences. So the entire thing, you can that structure is made to help you break down the thought process into certain chunks and to interpret it. So it follows a technique, it follows the REBT, CBT follows certain steps, which helps you identify ab kya karna hai, what could be the next step. So this is why REBT, CBT are often considered directive approaches of counseling. Okay, so if already किसी चीज के steps दिए हुए हैं, आपको दिमाग लगाना ही नहीं है, then it is less time consuming, because this method can be adopted when early solution is required, right? So if we know that exposure therapy helps greatly for phobias, then we would directly apply exposure therapy. Do you know what exposure therapy, what exposure as a technique is, which is often used for phobia?
Case, ma'am, if a person is afraid of something, so they are basically exposed to those things or
Right,
to
right.
those situations.
अगर किसी को सांप से डर लग रहा है तो उसको पहले 3D इमेज, उसको सिर्फ एक कार्टून इमेज दिखाएंगे स्नेक की, एंड आफ्टर दैट उसको कलरफुल इमेज दिखाएंगे which is still cartoon, and after that we would show a 3D image which is not threatening, and after that we would proceed with every attempt to reduce the fear, the phobia of the person by recording the pre and post responses of the person. So exposure therapy ke steps hain, and you can clearly, if anyone who gets a patient, gets a client for phobia, then there are clear cut steps which have to be followed for exposure therapy, which makes it easier for counselors and psychologists because it is less time consuming. Someone has already prepared a set of steps for you. So there is an early solution which can be done. And this method is best when less matured and less intelligent client interact with an experienced counselor, because you already have a preset set of solutions you can apply. You're not giving a solution. I want to clarify one thing. You are not giving a solution, but the kind of interventions you are going to provide, you are going to attempt in a counseling, they are very structured. They have a protocol. They have certain steps. So you can clear cut apply. It is not like कि मुझे मेरा मन नहीं लग रहा, जाके घूम के आ जाओ, या फिर मुझसे पढ़ाई नहीं हो रही, संदीप माहेश्वरी का वीडियो देख लो. You're not giving the solutions to the clients, but the approach you are providing is a structure. It has a structure, and it is less time consuming because it has been tested over and over time. CBT and REBT, exposure therapy, behavior therapy, these have been tested in various situations, in various disorders, in various cultural groups over and over again. So everyone is aware of their efficacy, that how to proceed for exposure therapy, how to proceed for this therapy, when to apply cognitive therapy, when to apply rational emotive behavior therapy. Okay, so but this is best method in lower levels where the client is not in a position to analyze his problem. So why this is best method in the initial levels of counseling? Because when the client himself is puzzled with his or her situation, then the client might require some assistance to do of certain things. Okay, I'll give you an instance. Suppose a client comes to me and says, my life is a mess. I'm not able to study. I'm not able to think anything. I'm almost consumed by anxiety. When I'm not doing anything, I'm sleeping. So here, the first few sessions would be to assist client in finding a balance of his or her life. So we won't be asking that person to think about his life choices, to think about what led to what could be the consequences of the choices, who added to these choices, what was the impact of his or her childhood experience in those choices. Right, the person is already puzzled by the processing of present, past, and future thoughts. We don't want to give additional stressor to that person. So in that way, we just ask that person or our client to follow a certain techniques which are readily available and can be helpful because they have been tried and tested over and over again. Okay, so in this method, the counselor becomes readily available to help the client, which makes the client very happy because abhi दिमाग नहीं लगाना पड़ रहा है client को. The counselor is doing most of the job. This is how it is. But demerits, let's talk about demerits too. So the client never becomes independent of the counselor. So our aim of a therapy or a counseling is to make the client independent. We don't want the client to come to us over and over again that, ma'am, this is the problem. Sir, please help me with this problem. Because when we are talking about directive techniques, we give away skills to the some skills, we learn some skills in a session, we role play, we give some homework to the client so that if certain situation emerges again, I have the ready skills, I have the set of skills which can be applied. Suppose I come up as a person that, ma'am, I have anxiety wherever I have to speak in public. So I, as a counselor, will deal with the anxiety, what does it look like and how that impairs the client's functioning in a public setting. Then we together we would do a certain exercises to ease the anxiety, what to do when the anxiety, identify the triggers which can for the anxiety, and then not just identifying it and doing something about it, introducing certain techniques to deal with anxiety, trying that over and over again, right? And then in future, if that person has to face the stage again, has to do public speaking, that person has a set of techniques which have worked for them, so that when there is another time when the person has to face the stage or face the crowd, the person is equipped with certain skills. उसको मालूम होगा उसको क्या करना है. अब एंजाइटी हो रही है, the person is able to identify कि yes, I am feeling the anxiety, I am feeling the symptoms. Now I also know what to do with that. If I am feeling a little conscious of going to the stage, then what I have to do. So in over and over in certain sessions, in many sessions, the counselor and the client together learn a certain techniques which can help. So हमको उसको independent करना होता है. But here in directive counseling, counselor is doing most of the job. Sometimes the client gets dependent on it. So it is not effective, but in the merits, as it was discussed, that it is helpful in the previous phases of counseling. The personal autonomy and integrity of the client is not respected. It leads to new adjustment problems. So the personal autonomy and integrity, that we are telling clients what to do. So we are not taking into consideration the personal autonomy. Agar client ki इच्छा नहीं भी होगी, sometimes we will ask that client to do something, even if the client does not want to do. Today, if the client is not feeling anything about doing a cognitive exercise, so we are sometimes it is not talking about that I do not want to do a cognitive exercise. So यहाँ पे it can lead to new adjustment problems, because as we all assume that therapy and counseling is a safe space where the client should be able to be what he or she is, where there are no boundaries. The client can exercise his or her desires and be a flawed person, whatever the person he or she is. There are no rules and regulations, where the client can be themselves and talk about everything. It should be that much safe space. So another demerit is it will not help the individual to develop any attitude through his own experience. Since counselor is doing most of the job, the client is not putting much idea and much thought processing, and not processing by introspection. So the client may or may not be able to develop any attitude through his own experiences. So sometimes the counselor fails in saving the client to commit the mistakes in future. If we keep helping the person again and again, the client might do the similar mistakes again and again. So this might be the demerits of the directive counseling. Okay. Okay, do you have any questions? Do you want to talk about any case you came across and which you felt you want to discuss here?
Ma'am, they become a client, then become dependent on the counselor. It is a demerit actually, and every time they take some decision about their own life, they continually think about their own counselor to ask him or her, or take him or her suggestion all the time. It's a main demerit, ma'am.
So do you think it is a good idea to be dependent on a counselor and coming for session over and over again for the same thing?
No, ma'am, definitely not. Because when they become dependent on a particular person, like counselor, their own personality development is hampered. For a certain time during his stress or anxiety period, it is okay, but not for a long period. It is good.
Absolutely. So the person has to go through his or her own story by self-introspection, by identifying, by going through his story again and again. Sometimes a personal work, narrative work is also required other than counseling. This is why it is advised that in between session, many types of techniques which are being suggested to the client, so that even after the session, the client can do certain work and identify some patterns, what could be contributing to certain patterns. If suppose if I am a client and I have an internalized voice which keeps saying me, you cannot do enough, you're not enough, you're not enough. But in between, in the session, with the help of counselor, I was able to identify that I do have an internalized voice which stops me from taking risk. Okay. But in between session, if I as a counselor do not give any homework to identify how much that internalized voice stops me from taking risk, for trying new things, how it is hampering me, where it is coming from, where did I hear it for the first time, then the person would not be able to gain insights about where it is coming from, what to do about it, and then share in the next session, right? Because one session is not enough. And sometimes the client himself does not know what to share in the first session or in a session. So the homework which is given in between 2 sessions and 3 sessions is not just a task or a homework per se which is given to client. It is an attempt to make client introspect about the problem, where it is coming from. Sometimes in the session, I'm not able to identify where did I hear that. But after the session or while doing the homework, it might occur to me that yes, in the childhood, that was the first time my mother told me, do not talk to strangers, do not go to stage, or don't speak to strangers, don't speak too loudly. And now it is hampering my ability to connect with people, because that internalized voice is constantly telling me strangers are difficult, strangers are not safe, public situations are not safe, unless I give that client a homework. So unless the client deals with the information other than which is provided in the session, how will the client get a holistic picture of the whole thing? I am not an andaryami person. The counselor does not know unless the client shares. And unless the client holistically introspects his or her situation from different aspects, how will the client get his own personal development, right? So this is why the directive counseling approach was criticized by none other than Carl Rogers, who said that okay, so now we proceed to non-directive counseling. So the directive counseling was criticized on the demerits that the client will never become independent, the personal autonomy and integrity is not respected, the client is not able to develop any attitude, you are forcing your rules and regulations and your theories on client. Sometimes even client has enough mental space to deal with their problems. They just need a space to deal with their problems. Why are you directing? Why are you, spoon feeding the client every step, everything? So this is why this technique was criticized by Carl Rogers, and who spoke about non-directive counselor, that you don't have to tiptoe the client to each step. You don't have to direct the client to each and every step. Sometimes you have to give the client liberty to explore his or her own thoughts. So okay, before we proceed, what was directive counseling called? Non-directive counseling is called permissive counseling. What was directive counseling called here? Who will tell me?
Prescription counseling.
Very good. You are listening. You are paying attention. In between, I'll ask questions just like that to know if you are paying attention or not. Okay. So permissive counseling, it is non-directive counseling is also known as permissive counseling. Permissive means the client is permitted to explore his or her own thoughts. It is very exploratory in nature. So in the directive counseling, the entire process was centered around counselor. Counselor was doing most of the job. But here in non-directive counselor, it is centered around the client. So when the client-centered process is there, the counselor is the pivot of the whole counseling process. Sorry, counselee. It is centered around this person. I am not deciding what to do. This person is deciding what to do. According to counselee or the client, we are moving ahead. So the main function of counselor is to create an atmosphere in which the client can work out his problem. So we have to, as a counselor, as a psychologist, we have to provide unconditional positive regard, or create a safe space where the client can be himself, herself, and where the client is able to work out his own problem. Right? Okay. Who knows about unconditional positive regard?
Unconditional positive regard means we do not judge the client, but what he told, we cannot judge the thing.
Okay.
Ma'am,
And pay
unconditional.
attention.
Yes, yes.
And pay attention what they say.
Okay.
Unconditional positive regard. Unconditional means without any condition. That means giving that positivity, the acceptance, the support to the client without any judgment or without any conditions.
Okay. So what we are talking about, why we are talking about unconditional positive regard is because, okay, first of all, it is not a element of non-directive counseling. Person-centered counseling is one of the approach of non-directive counseling, which was given by Carl Rogers. Okay, so since the entire thing of the entire concept, the entire approach of non-directive counseling was started by Carl Rogers. Carl Rogers also came up with his own technique, which is known as person-centered or client-centered technique, where the focus is on the client. And what the first step is saying, the main function of the counselor is to create an atmosphere in which the client can work out his problem. So we want to give a safe space, unconditional space. Unconditional positive regard means an empathy. The client feels understood, the client feels respected. Whatever the client feels is not judged. We have to provide a non-judgmental space, empathetic space. So where the client can feel at ease, the client is able to think of his problem and is able to come up to a solution on his own. So in the directive counseling, the focus was on the intellectual part, how the information process is in taking place, what are the faults which are present in information processing. Here the emotional elements are stress, how the client is feeling, how the client is perceiving, how the client is interpreting things, and how the client is feeling in a session, how the client is making sense and making sense of the entire situation, how the client is attributing the things and the situation to himself or herself. So the emotional elements are being taken into consideration. Okay, so now we'll talk about the steps in client-centered counseling. So the Carl Rogers has given the following steps of non-directive counseling. The first in defining the problematic situation. Defining the situation. We are not trying to analyze, we are just trying to define in the beginning. So the first step in the directive counseling was to analyzing. Here, we are just defining the problematic situation. The client is asked to express what he or she is feeling, and then free expression of feelings. We are defining what we are feeling, and then we are talking about it. So a few sessions could only be focused on client expressing what he or she is feeling. Yeah, what I am feeling, what is contributing to my feeling, contributed to my feeling. Is there any event which contributed to this feeling? What is that feeling leading to? So the free expression of feeling here, the role of counselor is not to ask, is not to break down the information. We are not breaking down any information. We are just giving the client to talk and talk and talk. But there are certain techniques which are involved in client-centered counseling. We'll come to that. So the second step is free expression of feeling. So it is assumed that the client is capable enough to develop an insight that yes, after breakup, suppose the client for straight 5 sessions, the client is talking about breakup, the memories associated with it, how the client felt about it, how the friends felt about it, what were the good memories, what were the difficult memories, what are the things which is bothering the client, how the client is coping with the current situation, if there is any support or not, how this entire situation of breakup has impacted the client. That the client is talking about it, and in between the expression of feeling, the free expression of feeling, the client is able to develop an insight that yes, through even if the breakup was traumatic one, I am able to come up to some wisdom, some conclusion that yes, this person was toxic, this person was good on the emotional aspect, but was hampering my life choices, or though both of us were good people, but we were not compatible enough, or our life choices were not compatible enough. So the person is able to come up to some insight, and with the help of that insight, we have to classify the positive and the negative feelings. What are some of the positive feelings which you are gaining from this insight? This, yes, I'm feeling bad. I had made a habit of speaking to that person. I'm not able to cope up with that. And negative feeling, sorry, that was negative feeling. And the positive feeling that, yes, I trusted that person enough to feel good about myself, that yes, I trust myself enough to share my personal beliefs, my feelings. I love myself enough, and so many things. So we are able to identify the positive and the negative feelings out of this insight, of that insight, of that experience. And after we are able to identify the positive and negative feeling, it is aimed that the client is able to accept the negative feeling, and the client is able to embrace the positive feeling. So we are not discarding the negative feeling, we are just coming up to some conclusion, some wisdom which we are trying to deduct from those negative feelings. We are trying to embrace the positive feelings, because every experience leads to some development in personality. So this is how. And after the free expression insight has been achieved, and we are able to clarify, then after that, clarify and classify, the termination of counseling situation is done, where a goal is met, that yes, I was a confused person, I was not feeling good about myself, my life choices, and the breakup was impacting me, and we come up to some kind of termination, and the termination is also mutual. So yes, let's talk about defining the problematic situation. The counselor should define the problematic situation along with the client. Free expression of feelings. After the first step, the client is made aware of the fact that he or she can express his feelings freely, and the counselor approves this. Development of insight. The counselor goes on thinking regarding the client's new feelings along with the development of client's insights, and he goes on classifying all those new feelings. Classification of positive and negative feelings. After free expression, the counselor identifies negative and positive feelings. Counselor is identifying the feelings, and the client is able to classify them. What are the feelings which evoke good vibes or good feelings? What are certain events which evoke negative feeling? Then the termination of counseling situation, and the counselor and the client looks for a point where they can terminate the counseling situation after all the steps have been met. And with the help of that, they are able to come up to a termination after coming up to certain points. Okay, the merits are it helps counselor to become independent and self-reliant, because we are giving the client enough space and time and unconditional positive regard, empathy, that the client is becoming independent. We are not feeding the client anything. The client is able to become self-reliant, and the client is able to self-direct. If in future similar situation occurs that a friend leaves the client, that client is able to identify what insights did I get from my previous situation, and is able to apply them. Suppose I'm feeling bad about my failed attempt at some examination. If next time I feel that my performance is not appropriate, my performance was not up to merit, then I am able to apply those insights which I got in the session in the present situation, that last time also I was able to get through this, so this is not a new situation, I am able to get through this. So this helps attain more sustainable adjustment to the situation. Sustainable, why? because the client is not going to counselor again and again for the problem. The client is able to make sense of the situation and is able to identify and apply the skills to his present situation. Okay, this type of counseling leaves an impression for a longer period because the client processes his or her own information, so the impact stays for a longer time. The demerit is because the free expression of idea can take a very long time. So sometimes this happens in this client-centered counseling, is that the free expression of idea can take a very long time, but the client is not able to come up to an insight. Then it might be time consuming, and it is not suitable for less matured and less intelligent counselor client. Sometimes the our clients are not matured enough to come up to an insight. So matured and less intelligent does not mean they are dumb, but they do not have enough experiences, or they are not old enough to make sense of the entire situation. So do you think a 10-year-old would be a fit client here? The 10-year-old is very young. The 10-year-old might require assistant of a counselor or a parent or a guardian for their direction to understand. But a 40-year-old is able to make sense of his or her situation, his life choices. And with the help of the counselor, the client here would be able to make sense of the entire situation, come up to some insights that here I faltered, here I could have done better. At that point of time, I was too blinded for that person's love that I did not appear for certain exams. So this is where I faltered. I should learn to put myself first. Okay, so these insights only come after a certain age, after a certain experiences. So this is where the client-centered approach or the non-directive counseling approach comes to help. So here the counselor passive attitude might irritate the counselee so much that the client might hesitate to express his feeling. Sometimes our client, the demerit is that sometimes the passive attitude of the client is might irritate the client because the counselor is not doing anything. Sometimes the client come with an idea that a counselor will provide a solution to their problem. They don't want to do brainstorming with their own ideas, with their own events. Here the client want a clear cut solution कि मैम डिप्रेशन हो रहा है, क्या करूं, बता दो मुझे. But that the person does not want to explore the contributing factors to that depression. The person does not want to know what are the factors, what are the situations, what are the events which led to this depression, right? The person sometimes is looking for a solution so much that the person does not want to go through the entire mud, the entire chaos of therapy. This is why therapy is sometimes can feel a little chaotic before it begins to feel a little, healing. It can be chaotic before you start to feel better, because you are reorganizing your thought process again and again. You are going through your life events again and again. Your body perceives those life events as threatening. So even after going to therapy, sometimes the clients might say, I'm feeling more anxious than before, because sometimes our body is not able to differentiate between an event which has happened or the neurochemical response which our body feels just by reminiscing that event. Does this happen? It can happen to every one of us. Sometimes mere the thought of an event, suppose you met with an accident and you were shaky, you were not able to speak, you went numb. 1 month later, even if you're talking about that incident again, you start feeling shaky, you're not able to speak anything, you go numb, because your body is going through that event again, even if it is not happening it in real time. So sometimes it can also happen. So this might take a little, it can get a little time consuming, it can get a little chaotic. when we come to therapy, when a client come to therapy, we have to tell them that what you are looking for here. Are you looking for a clear-cut solution, or are you willing to go back to your patterns, which might have been unhelpful, which might have been unconsciously learned? So are you willing to go back to those darker parts of your life, those darker parts of your memories you might have unconsciously repressed? In psychology, there is a term, hum repress kar dete hain, something which our mind does not like, it is too threatening, the mind perceives it as harmful. Our mind is so smart that it rugs it under the carpet. It keeps pushing things under the carpet again and again until it becomes a full-blown disorder. So our mind is very smart. Our mind is evolutionary. It has been trained on survival. It is not, sometimes it is not, sometimes it is not doing the job for taking up that threat and dealing with it. This is why sometimes we go numb on a situation, in certain situation, because that situation itself feels so threatening that even if we know what to do in that situation in a different setting, बाद में हमको सब मालूम होगा कि what we have to do, but at that point of time we go totally numb. We are not able to do anything. So there are so many techniques you will be identifying after the directive and non-directive. So there is one more technique, which is eclectic technique. We would be discussing in the next class, eclectic counseling. Okay, do you have any questions? I want to share certain techniques which are used in non-directive. Okay, so give me 5 minutes before I start the presentation. Before that, if you have any questions, any queries, any instance you want to share of your client, or any case which comes to your mind that, ma'am, what can we do if that happens? What was that client trying to do? Please go ahead.
Ma'am,
Yes.
मैम जो ट्रांसफरेंस एंड काउंटर ट्रांसफरेंस जो होते हैं, तो वो क्या डायरेक्टिव जो काउंसलिंग प्रोसीड्यूर है उसमें ज्यादा हो जाते हैं? ये जो माने ट्रांसफरेंस जो होते हैं, क्योंकि डिपेंडेंसी ऑन काउंसिलर ये थोड़ा ज्यादा हो जाते हैं, तो इसके ये एक डिमेरिट्स हो सकते हैं क्या?
ट्रांसफरेंस एंड काउंटर ट्रांसफरेंस,
यस मैम, माने ये क्या डायरेक्टिव काउंसलिंग प्रोसीड्यूर में ये क्या ज्यादा हो जाता है?
Actually, transference and counter transference can happen in both the settings, which both the approaches, whether it is directive, whether it is non-directive. So when we are okay, so directive में इसके chances कम होते हैं. The chances are less in directive because the counselor is taking charge of how we are proceeding in the therapy. So clear-cut steps are being followed. But when a clear flow of ideas or expression is promoted in non-directive counseling, so the chances that transference and counter-transference happens, it might get a little higher. The chances can get a little higher in the non-directive counseling, because now the person is able to direct their feelings onto that client, or the person is able to the therapist also able to transfer. There is two-way communication when we are trying to understand the problem, the issue, through free expression of ideas. So it can happen. It totally depends on the therapist or the counselor. But if a person is following a clear-cut formula, then the chances can be a little less.
Okay, ma'am. Thank you.
Anyone else has any question? No. Okay. Okay, so I want to now tell you how to use non-directive counseling. In the upcoming classes, Shreyashi ma'am would be teaching you various techniques, and you would be able to identify which one is directive, which one is non-directive. I'm not telling you beforehand, but if you would see a structure or a free flow of ideas, if you have understood today's lecture well, you would be able to identify which one is directive, which one is non-direct. Okay. Can you see the screen?
Yes, ma'am.
Okay, so when we are talking about non-directive counseling, then it requires a certain space how to use the counseling. So the efficacy of non-directive counseling, sometimes when we are talking about non-directive counseling, we were thinking कि सारा काम client को ही करना है, counselor तो just can chill and nod. But no, the way non-directive counseling appears, it is not exactly like that. You have to make that space, and यहाँ पे भी you have to use certain techniques which are used in non-directive counseling, because the client, sometimes you would get lucky and you would find a client who would just come up and vomit everything which is going on their mind. But sometimes you have to lead the client so that the client can share some information. You have to provide certain prompts to the client. So how to use non-directive counseling? You have to arrange a time and place which would provide privacy for your conference. Of course, a person can only share his or her very deep memories and meanings and the things they want to share, and only when it is private enough. We cannot have such deep conversation in a public setting. So privacy is very important. Confidentiality is very important. You have to ensure that whatever information that client is going to share, it is going to remain confidential, even if it feels like reason for gossip. But no, there are certain ethics you have to follow as a counselor. You have to respect the privacy and confidentiality of the client. Only when the client trusts you with his or her secrets, they would be able to share the details of where it is coming from, right? If the student here, assume client, if the client does not open the session, use a leading statement or question to focus him or her on the topic of concern. Sometimes you would meet clients which are seeking therapy, but they would come and become mute in the session. अब हमने तो ये सुना है कि नॉन डायरेक्टिव काउंसलिंग में हमको कुछ नहीं करना, but we will have to provide some statement, any leading statement to help that person talk. Okay, so we would talk about the leading statements and how to question, how to probe that person, so that the our client is able to talk about their issues or talk about their concern. Listen to the client in an interested, non-punitive, accepting manner. Make no judgment. So there is something about counseling. So when we have to look interested, we does not have to follow a certain demeanor on the face. Our body language has to look interested. So there are certain body languages you have to master. You have to be, when you are in a counseling session, you have to be very observant of how your body language can be interpreted in a such way. If you are a counselor, and even if you are not speaking a single word, your body language, your expressions speak a lot about if you are interested or if you are judgmental or not. Whether you are saying okay, but at any point of time, if you mistakenly, unconsciously raised any eyebrow, your eyebrow, that the client would stop then and there. The client would resist sharing any information. So even when you are in a tele-counseling session, even if only this part of your body and your face is visible, you have to be really careful of what your expressions might be looking like. You have to appear interested, accepting, non-judgmental, even through your non-verbal appearance, right? This is very important because it is easier to look interested through leaning, through certain vibes which you provide, right? But when you are in a telecounseling session, sometimes it is not, it is difficult to look interested. It is difficult to look non-judgmental. Sometimes you might be distracted. Suppose you are taking a session here, but your phone is vibrating, or you're looking at something, or you are hearing to you can smell something. The client can quickly make sense that now you are getting distracted and you are not listening to the issues or the presenting concerns. So if you are a new in tele mental health counseling, prepare a few things beforehand. You have to do a few mock sessions with your counselor so that the counselor can identify where you were lacking. If your body language was looking interested, you were non-judgmental, or do you have a tendency of making exaggerated facial expression during counseling session? How to appear interested without speaking a word, right? So our body language, even if in a telecounseling session, even if you are talking through phone, our body language, our micro expression, our tone of voice can talk a lot about your efficacy as a counselor. So these things are not very small things. These are not just words. This if you want to become an effective counselor, you have to master these things, right? Respond when appropriate using one of the recommended techniques. We'll talk about the techniques here. So there is also a very good impact of when to take pauses, when to ask questions. Sometimes the client is in a mood to talk a lot, but you have a question popping in your mind and you want to interrupt, but you have to resist your urge to interrupt then and there. You have to give that client enough space to vent out, and even after the client is done, very politely you have to give a question do you want to talk more about that? So one thing in counseling session you have to refrain from is asking why, what, when. We don't want to ask the WH question, how, because these can appear attacking. We don't want to attack the client. When the client feels attacked, the client would stop sharing immediately. The rapport you are trying to build, it would be interrupted then and there. So you have to identify, you have to put your statements in a manner that the client is also eager to respond to that statements, but at the same time those statements are not offending, are not blaming, are not attacking, do not seem attacking to the client. Okay, so yeah, so identifying the following responses to a student commentary as being leading statement, question, reflection, clarification, open question, close question. Okay, so how are you feeling? I wonder what happened. So we want to talk about, okay, we haven't discussed certain techniques. Sorry. So there are certain techniques of non-directive counseling. Reflection means restating the student's comment. This may be done in the exact same terminology, or by repeating part of the comment, or by rewording the student or the client. Where yahan pe jahan pe bhi student likha hai na, please assume it is client. Okay, so when we are using reflection, we are using the same terminology, or repeating a part of statement, or by rewording a statement. So reflection means the client can understand that you are listening, and promotes continued commentary. The reflection would look like, if I say, ma'am, I'm not able to focus these days. So I will say, I can see that you're not able to focus these days. So मैंने यहाँ पे क्या किया? I reflected. What do you understand by reflection? There is a mirror. and I'm reflecting. But here I'm not reflecting, I'm not mimicking, I'm not saying same to same nahi bol rahi hu main. I'm just using the same, the essence remains the same, the words are just paired differently. So if a client says, ma'am, I'm feeling more anxious than ever, so I would say, I can see that you're feeling a little more anxious than ever. I don't want to say, I can see. You're not a robot. You're not mimicking the statements as it is, right? The second response is by leading statement or a question. So, हमारी tendency है as human being to ask क्यों, but a क्यों, why can look a little alarming to that person. Alarming, attacking, blaming. That person, the Q and the Y and the WH questions put client in a attacking position, that a client feels, the client feels attacked. So even if we want to lead our client in a certain direction, we want to know something more about it. So we would lead, it is designed to encourage our client to elaborate on the topic. जैसे कि I'll give you a very funny example. हमारी tendency है, it is our tendency that whenever we are on a call, when we are talking to our friends, we would say और bata could look a very irritating response. But if we want to look interested and if we want our friend to elaborate on the topic, we would say, और क्या हुआ था वहां पे, and अच्छा इसके बाद में आप लोग वहां पे गए थे. So the person, the client would feel interested that I was listening to it, would not feel attacked, and would be interested to elaborate more on the topic or something or a problem. So the statement, the example of leading could be, I would like to hear your opinion, or tell me more about how did you feel. Will you be comfortable talking more about that? What happened then? So even if you're using you're using it in a very comforting manner, so as to not attack the client, but to receive more information in a very comforting manner. The third response is clarification. It involves stating the implied feeling behind a client verbal communication. So when we are clarifying, so after talking 15 to 20 minutes, suppose you have a client who is talking about their deceased grandfather due to COVID. अभिषेक को मालूम होगा अच्छे से कि किसी की डेथ हो गई, तो उसके बारे में बता रहे हैं 15 मिनट से 20 मिनट से रोए जा रहे हैं, बता रहे हैं. It has become a very senti situation. So you want to conclude that, and you want to also clarify that, yeah, it appears that the death of your grandfather has impacted you. Okay, so we are stating the implied feelings. We are in a way concluding something. The implied feeling is that yes, you sound sad. It appears that you are very angry. So clarification helps the client to identify his or her feeling, that after describing everything, what is the core feeling? And it can also be used to focus the students' thoughts on ways to deal with emotions which are present. Sometimes our client is going through a whirlwind of emotions, but they are not able to name them. So by providing them with a summary or a clarification, oh, you're feeling sad, you're really impacted by this, you appear angry. So we are giving their emotions a name. And after naming an emotion, they are able to direct all those feelings to that emotion. What is the difference between feeling and emotion? Who wants to say? What is the difference between feeling and emotion?
मैडम,
हाँ जी, बताइए.
मैडम, फीलिंग मीन्स उसको क्या महसूस हो रहा है.
अच्छा.
एक्चुअली, और इमोशन में उसका भावना, मतलब वो भावनात्मक कहना क्या चाह, उसकी मतलब उसकी
आपने तो
स्टेज क्या है?
इंग्लिश टू हिंदी ट्रांसलेट कर दिया।
हाँ, उसको मतलब मैं एग्जांपल से बताता हूँ। एक्चुअली जैसे हम किसी मतलब उसके पेशेंट के पास गए, तो वो कहता है मैं अनकंफर्ट फील कर रहा हूँ। मीन्स वो कभी मतलब उस प्रेजेंट में वो प्रेजेंट सिचुएशन को अनकंफर्ट फील कर रहा है, लेकिन वो इफेक्ट जो है वो उसका किसी और रीजन से वो इफेक्ट है काफी टाइम से, लेकिन जो ऑन द स्पॉट जो फीलिंग आ रही वो अलग है। और वो भावनात्मक, वो कहीं से किसी से टूटा हुआ है या कुछ हुआ है या कुछ हादसा हुआ है, उस वजह से वो मतलब उसको प्रॉब्लम हो रहा है, लेकिन प्रेजेंट सिचुएशन उसको को मतलब हम कहते हैं कि अभी क्या फील कर रहा है यूं।
ओके,
बहुत सी वजह से आपने शुरू में बताया था वॉइस का, तो वॉइस स्मार्टनेस तो बहुत जरूरी है इसमें।
बिल्कुल।
हाँ, जैसे हम मिलते थे तो हम गुड मॉर्निंग की बजाय खुश मॉर्निंग बोलते थे, उससे एकदम इन्वायरमेंट चेंज हो जाता था। फिर ड्राइंग बनाने को देते थे, कलर्स बनाने को, मतलब कलर्स देते थे, व्हाइट पेपर देते थे ताकि वो ड्राइंग बनाए, थोड़ा सा अपने आप को नॉर्मल फील करे, इस तरह से।
वेरी गुड, वेरी गुड। सो जब आप कलर्स उनको दे रहे थे एंड आपको खुश मॉर्निंग बोल रहे थे, ये रैपो बिल्ड करने की टेक्निक भी तो हुई ना? You were trying to build rapport with the client.
ना, एक्चुअली हमारा जो सिचुएशन उस तरह था कि वो बहुत सैडनेस था इन्वायरमेंट में। इवन जो इसमें जैसे मैं बता कोविड के टाइम में, तो हमारा जो स्टाफ था वो भी बड़ा मतलब डाउन हो गया था, तो एक इन्वायरमेंट चेंज करने के लिए हम सबको गुड मॉर्निंग बजाय खुश मॉर्निंग करता कि थोड़ा सा हमें हैप्पीनेस, क्योंकि बहुत 1-2 महीने से इतनी चीजें हो गई थी, तो ताकि वो इन्वायरमेंट चेंज हो। मैम, रेपो का तो कोई प्रॉब्लम नहीं था, क्योंकि रेपो तो ऐसा कुछ सिचुएशन ऐसी थी नहीं कोई रेपो बिल्ड करे। बस ये था कि बिलीव सिस्टम स्ट्रांग हो और कॉन्फिडेंसली काम कर सके हम भी, और काफी क्लाइंट, हमारा जो क्लाइंट है, पेशेंट है, वो भी नॉर्मल रहे।
राइट, राइट। Anyone else want to attempt the difference between feelings and emotion? Come on, there is no right and wrong answer. We are here to learn.
एक्चुअली इमोशन जो है वो ऑलरेडी आ रहा है, और फीलिंग्स है इंडिविजुअल, जो इंडिविजुअल पर्सन फील कर रहा है, वो इमोशन को कैसे वो फील कर रहा है, हाउ दे आर फीलिंग, दे आर, और इमोशन को कैसे वो महसूस कर रहा है, इसके ऊपर डिफरेंस होता है। माने इंडिविजुअल फीलिंग, इंडिविजुअली जो इमोशन को कैसे फील कर रहा है वो फीलिंग्स में आ जाएगा।
Okay, very good. Anyone else want to try?
Yeah, ma'am.
Yes, please.
May I, madam?
Yes, please. Anyone else?
Yeah. In my opinion, feeling is the mean state of mind in a present situation or in a situation of a, but emotion is the state of inner mind, and it prolongs for many much more time than a feeling, because feeling changes certainly on it is not a constant one, but emotion can be a constant one. Is it, madam? Am I true?
Okay, that was interesting. अच्छा, अब ये कौन बताएगा, फीलिंग पहले आती है या इमोशन पहले आते हैं?
मैडम, इमोशन का ही तो आउटबर्स्ट फीलिंग में भी आते हैं ना। एक तो इनर मैटर है जिसका हम लोग इफेक्ट जो है वो फीलिंग में आते हैं, पर इमोशन तो अंदर में है ना, वही तो फील करके हम सोच सकते हैं। इज इट, मैम?
ओके, so all of you were right in to some extent. So okay, so feelings are generated as a result of emotional response. That means emotions हमारे दिमाग में generate होते हैं due to some neurochemical response, and when that neurochemical response को हम label करते हैं, that is called feeling. So a neurochemical response which is responsible for joy. So जब वो high होता है, that is named as joy. And when it is low, then it is labeled as sadness. As simple as that. Emotion से पहले आता है. अच्छा बताओ, ABCD में पहले E आता है, पहले F आता है?
E.
हाँ, तो इसको ऐसे याद रखना है, E पहले आएगा, F बाद में आएगा. इमोशंस हमारे ब्रेन में पहले स्टार्ट होते हैं, एंड उनको नेम जब करते हैं, व्हेन वी वांट टू नेम दोज emotions, sorry, that the release of chemicals in brain, when we name them, it is called as feeling. So this is one important aspect you should learn. Though we used these terms interchangeably, कि मुझे emotion आ रहा है, मुझे feeling आ रहा है, but when we name it, it is feeling. But what is happening in the brain, the neurochemical responses, the work of neurotransmitters, that is emotion. Okay. Yes, Abhishek, आप कुछ बोल रहे हैं?
मैम फीलिंग्स तो क्या बहुत सी बार वो एक्सप्लेन नहीं कर पाता है, वो बाद में सेकेंडरी थिंग में आता है.
हाँ, वो सेकेंडरी आता है ना, क्योंकि हमको फील हो रहा है, हमारी बॉडी में पूरी झुरझुरी आ रही है, बट हम उसको नेम नहीं कर पा रहे हैं. एवरीवन एट सम पॉइंट ऑफ टाइम. अच्छा ये बताइए, हमने सबने एंजाइटी फील की है, बट हमको उसको एंजाइटी बोलते हैं, वो हमको बहुत टाइम के बाद में मालूम चला ना.
यस मैम.
उसको खुशी बोलते हैं. जो ये फील, जो अंदर जो हमारे इमोशन जनरेट हो रहा है, उसको बोलते क्या है? उसको खुशी का नाम देते हैं, उसको दुख का नाम देते हैं, उसको चिड़चिड़ाहट का नाम देते हैं. तो ये जो नाम देना है, दिस इज कॉल्ड फीलिंग. बट द थिंग यू आर एक्सपीरियंसिंग इन योर बॉडी एंड इन योर माइंड, एवरीथिंग इज इमोशन.
एक एग्जांपल था इसमें, बच्चे के लिए था मैडम. जब बच्चे को बताते हैं कि भाई अब उसको सुगंध तो पता नहीं है, लेकिन वो कहे बदबू आ रही बहुत बढ़िया, क्योंकि उसको
बदबू आ रही है.
तो हम कहते हैं नहीं उसको, तो इस तरह से मतलब वो आइडेंटिफाई, वो एक्सप्लेन नहीं कर पा, लेकिन उसकी भावनाओं को समझना पड़ता है. उसका भावनाओं को समझना पड़ता है, शब्दों में नहीं जाना पड़ता, उसके पीछे के रीजन को जाना पड़ता है. ये हमारा लेक्चर मेन मोटो भी हमारा यही होता है कि एक्चुअली भावना क्या, भावनात्मक वो क्या सोच रहा है, कि एक्सप्लेन तो वो शब्दों से नहीं कर पाता बहुत सी बार. ये ओके, थैंक यू.
Okay, let's move ahead. Yes.
So you are just trying to say that emotion is the cause and affect is feeling.
Right.
Okay.
Ma'am, it seems like in one place fire is burning already, but when I am touching the fire, it is the feeling.
Yes, absolutely. So जो हमारी शेर को देख के जो हमारी बॉडी के अंदर न्यूरोकेमिकल रिस्पॉन्स आ रहा है, that is emotion. बट हम उसको बोल रहे हैं डर लग रहा है, that is feeling. हम उसको नेम दे रहे हैं, we are labeling it as something. डर लग रहा है, जान जा रही है, whatever we name it, but all those things are labeled as which is feeling. Okay, so I think this clarification or this differentiation between emotional and feeling is not going to leave your head. Okay, so let's go ahead with. Okay, so when we are clarifying, so we are helping that person understand how they are feeling. So in a way, we are also summarization. So the fourth summarization is a review of what has been discussed thus far in your counseling session. A good and effective counselor would always summarize at the end of a session. The summarization allows both participants to briefly reflect on what has occurred, view it clearly, and use it as a new starting point from which to build on the upcoming session. So after our first session, we would summarize that you described that you were feeling these difficult feelings of, you were feeling this difficulty with your life after your failure in examination, and then you're not able to concentrate, you are even feeling anxious of filling up a new form, you're also doubting on your performance, So जो एक पूरे सेशन में जो पूरी बात हुई है between the counselor and the client, the insights which have been there, the insight, the wisdom, the new revelations which have been discussed, we have to summarize and reflect on it so that you know where we had started and where we are concluding in a session. So every session has a beginning as a goal, even if we are not able to meet the goal, but there is some kind of summarization. Even if we were not able to do any exercise in a session, any activity in a session, but we should be able to summarize that today we discussed about this and this, and in the next session we would attempt to discuss that what were the events which led to this, right? So summarization not only helps in concluding a session, but also it you know, उसके लिए एक foreground, एक ground भी बन जाता है for the upcoming sessions. The fifth response is questioning. Questioning is a very tricky thing, because the questioning, if you do not know how to question well in a counseling session, आपका client आपके 2 session में भाग जाएगा, because उसको नहीं पसंद question होना. The client does not like questioning unless it is done in a very professional and very calculated manner. So, acha, who can tell me what is the difference between closed type question and open-ended question? सामने लिखा है.
मैम
जो है
एक ही बोलेंगे.
ओपन एंडेड जो है वो तो
one person at a time. हाँ जी, सुदीप्ता.
इलाबोरेटली आंसर आता है.
Okay. Okay, so who will tell me when can we used? Okay, session की starting में हम लोग close ended question use करते हैं या open ended question use करते हैं?
Madam, it should be open ended at first.
Why?
It will help to means reveal ओ क्लाइंट को अच्छा बोलने के थोड़ा means মौका বলার একটা মানে সুযোগ পাবে নিজের সবকিছু আর কি. He can open up his own feeling, and so there will be helpful for means discussion, and client will feel free, home-like feeling with the counselor, so that he can disclose his feeling and say whatever you want to say.
Absolutely right. So right, hit on the nail. So when we are talking about counseling session per se, we have to move in a funnel-like manner. In the beginning of the session, when we want to encourage the client to share more, we want to encourage the client to talk more about his or her issue. So we want to encourage of more on the open-ended question. So a narrative or a storyline can be provided by the client. The detailed information can be there. The client is able to talk at a greater length on the topic. The client can provide so many instances, so many events, so many interactions, interpretation, बहुत सारी detailed information. But when we are trying to fill in the gaps and we want to yield brief, specific information, then we have to go towards the close-ended part. So we are gradually moving from open-ended to close-ended. So this is why, okay. So, and in the initial stages of our session, we aim at open-ended question, which requires a very reflective and elaborative expression, free flow of ideas and expression. And towards the end of it, we are aimed at close. So when we find certain gaps in the information, and in the open-ended shuru mein the client also feels comfortable, but after the client feels comfortable enough, the won't feel offended with the close question. The client would also be interested enough to provide the details about her story. Okay, ji. Aage, let's move ahead. So I want all of you to write down all these 5. We have discussed these 5 types of responses: reflection, leading, clarification, summarization, and questioning. And I would be sharing a set of these activities, and you have to name kaun sa hai out of these 5. Okay. I would be giving you a set of questions. ये वाला questioning है, ये वाला क्या है? What is the type of responses which is given in the question? You have to identify the type of responses. Questioning है, reflection है, clarification है, open-ended है, close-ended है, summarization है. Sometimes it can be 2 more than also task for this after this session. And I would also share this PDF with you where the description of each response type is given. So why were we talking about these response type? Because in a non-directive way of counseling, we want the client to, we want to probe the client, but also not given too much. So we want to tell the client, we want to indirectly deal with the situation so that the client share as much as they can. Okay, so this is our aim for the non-directive. So this is where I would conclude directive and non-directive counseling. In the next session, we will talk about the third approach, which is eclectic approach. So do you have any questions?
Ma'am, this question after solving, we have to send in the WhatsApp group.
आप ट्रैफिक में हैं? Okay, yeah, go ahead. Arpita, who was speaking?
I was asking that are you sharing this means PPT with us in our group?
Yes, I would be sharing the PPT with you. And even if I am not able to share the PPT, you can go through the YouTube lecture and make your own notes. I think that would advise.
Please provide us the PPT, because it is actually it is a 2-hour session, so it is not possible for anyone to listen all the 2-hour session again and write it. So please provide the
PPT, and I would also provide that page and the homework to identify the response types. Okay, and I would.
When we have to submit that? Actually, you are telling that we have to submit, but when? What is the time limit, and when?
You will get enough time. Don't worry. The next approach, the eclectic approach, is going to happen after 1 to 2 weeks. Before that, many counseling approaches would be covered by Shreyashi ma'am and Ishani ma'am.
No, I am asking that when we have to submit that question answer, say, or what you are giving
you would get enough time, at least a week.
Enough time means how much? Means
1
how
week
much
should
days?
be enough.
Yeah?
1 week should be enough. Do you need more time?
Okay, if you are telling that 1 week, then it's okay. I am telling that just specify the time so that we can be prepared.
Definitely, you would get enough time, because today we discussed both the approaches quite in detail, and you might want to go through the PPT and the PDF which would be provided for your understanding. So if 1 week seems a little less, we can extend it up to 2 to 3 weeks. The learning outcome is ensured. rather than completing it on time. You should be able to identify and use these responses in your sessions. That is the aim, rather than doing assignment on time. Because in the next session, I would be sharing certain case studies with you, so that you are able to identify what kind of approach do you want to apply in these case studies. So since we would be doing case studies, your final task is to do case studies, but in order to identify and in order to effectively complete your case studies, you should be having an understanding of how to apply the knowledge you have learned. Okay. So don't worry, if you have any questions in between the sessions, please feel free to ask. Do you have any more questions? Anyone has any questions?
Yeah, I have one more question. Please. Regarding the case studies, is there any prescribed format for doing the case studies? If so, please provide us the format.
We will be sharing the format with you. Anyway, we have a dedicated class just for the format. We just don't want to give you a format. We want to discuss the format and how to put information in that format. Because you would be case studies is a very important part of working as a psychotherapist or a counselor. So
Madam, if possible, please give us that format, means cause it is only 2 months course and already 1.5 weeks
we would give you the format in a PDF form as well, and we would also discuss, because not everyone else
in next day, ma'am. Is it on next day?
No. Next day not. There is a schedule. Okay, we already provided you a schedule, right? So when me and Priya ma'am will discuss the case history and MSc taking, after that we will give you the format. Okay. So before first we need to do a class with you, how to take case history, how to take mental status examination, right? Then we will give you the format. Okay.
Okay.
Okay, Arpita. Abhishek,
okay.
Priyanka, do you have any questions?
No, ma'am. Thank
you. No, thank you very much.
Thank you, ma'am.
It's really good session.
Thank you so much. Then I would share the materials with you. Please be patient. Okay, and have a good week ahead. I hope this class was fruitful for you. And if you have any queries, please feel free to ask in the WhatsApp group. Thank you so much.
Thank you, ma'am.
Thank you,
Thank you, Priya ma'am. Thank you, Priya ma'am, for this teaching class. So, sir is not there. So, okay. So, we will have our next class on Tuesday, 8 p.m. and sir will be taught about statistical approach of counseling, right?
मैम वन क्वेश्चन, हम लोगों का जो रिसर्च पेपर के लिए, हेलो,
हाँ जी बोलिए।
हाँ मैम, जो रिसर्च प्रपोजल हम लोगों का करना है, तो when we prepare this or when we will submit this, ma'am?
Let's do one thing. Let's finish this lecture here. And if you have any queries, not just regarding this lecture, but regarding case history, regarding the materials, regarding the schedule, everything, please drop in the WhatsApp group so that everyone else can also go through the solution of the discussion. Okay?
Okay, ma'am. Thank you.
Thank you so much. You were a great bunch of students. Hope to see you again in the next Eclectic Approach. Have a very good evening.
You too, ma'am.